Guys, this is for real. No joke. Have heard it several times from my patients. You go to bed with a straight penis. You wake up at 3 to go to the loo, and your penis forms a crazy angle. That moment scares the daylights out of you, I can tell you. I'm talking about the greatest taboo in men's history. In Germany, we call it IPP. In the rest of the world, this nightmare is known by the name Peyronie's disease. I'm Dr. Stefan Buntrock, one of the most copied urologists on YouTube. This is a video about a condition that hides deep down in the shadows of men's pants, a disease that rarely sees daylight, something nobody talks about. Yet probably 1 in 10 men will get hit by it. When it strikes, you have 2 options: do nothing or be quick. But let's start from the beginning. And yes, it always starts with subscribing and liking, so you don't miss important videos like this. And if you also want something in writing, join my newsletter, link in the description. So what kind of disease is this? Simply put, it's wound healing, but not the normal kind. It's a type of wound healing that doesn't know when to stop. It affects the thin layer of tissue wrapped tightly around the erectile bodies of the penis, the tunica albuginea. Whenever the body heals an injury, it leaves behind a small scar. That's normal. But scar tissue is connective tissue, the same material your tendons and bones are made of. Strong, stiff, and not very flexible. And here's the problem. You really don't want that material piling up inside your penis, especially not in the tunica. That layer has to stay smooth and elastic so the penis can expand evenly during an erection. But when too much connective tissue gets deposited in one spot, it creates a stiff patch, and that patch acts like a hammock. As the erection expands, everything stretches except the scar, and the penis bends toward the scar, exactly like a tight hammock pulling down on one side. So how do you actually get injured? Very often it's blunt trauma during sexual activity. My patients describe the same sequence. It hurts for a second, the pain disappears immediately, and then, weeks later, the penis suddenly begins to bend. But you don't need a dramatic accident for this to happen. Diabetes is a known risk factor. Genetics play a role, and there is a close connection to a condition called Dupuytren's contracture. That's when you can't fully straighten the 4th and 5th fingers of your hand. Same biological mechanism, different location. What are the early signs and symptoms? Surprisingly, in many men, nothing at all. These are the ones who get hit out of nowhere. The men who wake up at 3 a.m. terrified because their penis suddenly looks different. As I said, no joke, this happens. In other men, erectile pain shows up. They wake during the night because normal nighttime erections start to hurt. That pain usually lasts 2 to 3 months and then fades away. Over time, the penile shaft may start to look dented or narrowed. We call that an hourglass deformity. And often, you can feel a firm nodule exactly at the site where the scar tissue is forming. Here's some more bad news. The penis will shrink. How much? It varies. But in many men, it's enough to notice and enough to worry. Erectile dysfunction is another frequent side effect, and of course, the angulation. Some men are lucky and get away with a few degrees. Others are not. In fact, some angles become outright grotesque. 70, 80, even 90 degrees. That is a realistic scenario. And here's what makes Peyronie so difficult. The inflammatory phase can last up to 2 years. During that time, you never really know if the curve has stopped progressing or if tomorrow will make it worse. That uncertainty is torture for many men. No wonder erectile dysfunction feels like peanuts in comparison. When your penis is bending towards 90 degrees, rigidity is the last of your worries. This is why real medical counseling matters. Not hope, not guessing, not waiting. Guidance, understanding, a plan. So here's the standard procedure according to the guidelines. You wait for 2 years, then you wait another 6 months to confirm that it's no longer progressing, and only then do you operate. But in my experience, that's something many men simply don't want to do. Honestly, guys, who wants to wake up every day looking down and check whether the penis has become shorter or more crooked? Nobody. Absolutely nobody. And this is where we have to step outside the guidelines and into reality. Because yes, much of Peyronie's therapy is not solidly supported by science. Not because doctors are clueless, but because no single therapy reliably reverses the disease. Most men are laser focused on correcting the angle, and I get that. The bend is the most visible part, but angle is just one therapeutic target. We want to stop the inflammation. We want the pain to subside. We want to restore length. We want to improve erectile function. And then, yes, we work on the angulation. But let me tell you up front, correcting the angle is the master move and the hardest one. In part 2 of this mini-series, I'll walk you through the non-surgical treatments I use in my practice. If you don't see the link here, the video isn't online yet. I will add it as soon as it is. Subscribe, share, and like, and I'll see you there. I'm Dr. Stefan Buntrock, always copied, never matched.